What's up, everyone? Welcome to the September edition of the P3 Rehab Monthly Newsletter. Thanks so much for tuning in. I figured with September being just around the corner, it'd be a great thing to go over some hip flexor assessment and stretching. With a lot of us going back to maybe school, university, potentially even commuting a little bit more and getting back into the office more frequently, hip flexor tension, so tension through the front of those hips, is something that we might potentially deal with. And it's a stretch that I see people do pretty ineffectively, and sometimes it leads to them not getting the results that they want in terms of relaxing some of that tension through the front of their hips. So let's do a little assessment here. I'm going to show you a quick and easy way that you can screen for yourself and then determine which hip flexor might need stretching in your case, as well as how we can do that properly. So all you'll need for this: get yourself set up towards the edge of your bed. It should be something that's lifted off of the floor. As you'll see in a second, I need my leg dangling over, so edge of the bed tends to work well. If you've got an exercise bench at home, that can also be something that works well too. So let's get it started. If we're experiencing some tension through the front of the hip flexor, there's two main muscles that can be affected. One is the psoas, which just acts as at the hip. Another one is called the rectus femoris, which will act at the hip but also at the knee. So that's going to be an important piece when we start to get into some of the assessment in just a moment. So, easiest way to set this up: think of your sit bones, so the bones that you would really sit on when you're making contact with the seat. I want you to be right on the edge of the surface that you're using for this assessment, right on the edge of those sit bones, okay? I'm going to demonstrate an assessment for my left hip flexors. A couple important cues I want you to think about here. Don't ever arch the back when you're performing this assessment, okay? We're assessing the hip, we're not assessing the low back, so I want the movement to come out of that ball and socket joint in the hip and not as much through the low back. So what we're gonna do is, I'm gonna be on those sit bones, like I said, towards the edge of the surface that I'm sitting on. Grab the right knee in this case, bring it as close to the chest as possible, round the back slightly, and then let yourself drop backwards, okay? Once we're in this position, you can see I'm nice and flat with my back against the surface of the table here. I'm not seeing any arching through the back because that's going to affect the results that we're getting. So again, nice and packed in here. All I'm going to do is try and relax that left leg and let it drop as far down towards the table as I can. As you can see in my case here, my thighs are resting flat on that table, so I do have some tension through the front of that hip flexor, okay? If we want to determine if it's affecting just the hip or affecting the hip and the quad, an easy way to do this is if you just gently straighten your knee out and you fall a little bit more, that can tell you that it's affecting one of the hip flexors known as the rectus femoris, which has a function on the knee and the hip. So again, if I get here and I'm restricted and I kick my leg out and I can get a little bit further, that tells me it is the rectus femoris. If I'm restricted here, I kick that leg out and I don't go any further, it's going to be what's called the psoas. So once you determine that, and it might be different on the left versus the right side, we can quickly get into some stretching, which I'm going to show in the next clip, so we can get you rid of that front of the hip type of tension that you might get in the next coming month or so. Okay, so now that you've identified whether it's the rectus femoris or the psoas that is contributing to some of the tension you're feeling at the front of the hip, let's go over some stretching that you're going to need to rectify that feeling of tension there. So, as you saw in the assessment, it was super important when we're assessing hip flexor length to keep that low back nice and flat so you're not altering the results that you're getting out of the test. Same thing applies when you're doing the stretch. You want to really ensure that you're keeping that low back flattened so you're driving all of the stretch through that tight hip flexor. So, a couple things that we're going to go over. First is going to be how to maintain that proper pelvic position. Then we'll go over a stretch for both the rectus femoris and a stretch for the psoas. Pretty similar, there'll be just one subtle difference to make sure you're driving tension to one muscle versus the other. So first and foremost, if we get in a standing position, we place our hands on our hip bones, which are called our iliac crests. Two things we can do with our pelvis. We can tilt our pelvis forward like we're sticking our tail out behind us, or we can tuck our tail in between our legs like we're flattening the back. For our hip flexor stretching, this posterior pelvic tilt where we're tucking the tail between our legs and flattening out the back is going to be the most important thing to maintain for the entire duration of the stretch, okay? So once you feel like you've got a good hold of that anterior versus posterior pelvic tilt, I want you to then transition into the stretching as follows. So If we're stretching the rectus femoris, we know that it has a function on both the hip and the knee. So because it helps to straighten the knee, if I'm bending the knee in this position, I'm already going to be placing it in a position of tension to bias that specific hip flexor. If I'm setting this stretch up, I like to have the side that I'm stretching, so in this case the right knee directly under my hip so they're in one straight line. Then I'm going to get my left leg up in front of me for a little bit of balance and support. And then I'm going to get into that posterior pelvic tilt where I'm tucking that pelvis and flattening my back out, okay? If you're someone who has a lot of tension through the front of that rectus femoris, you might already feel some tension radiating or some stretch radiating down the front of that leg. That's great. It means you're doing it effectively. If you don't feel the tension yet, that's also fine. What you'll need to do is keep that pelvic position and that back flattened out, and then slowly just translate the weight forward onto the front foot until you develop that stretch and that awareness through the front of the thigh, okay? If I translate and I see arching through the back, I've lost all the tension that I'm trying to release out of that hip flexor. So I really want you to focus on keeping that position, and it's just a subtle shift forward in terms of weight onto that opposite foot. Okay, so that'll be a way to stretch out the rectus femoris. The only thing I would change if I'm trying to bias a little bit more of the psoas is I would keep that right leg totally straight. So now I'm not getting that bend out of the knee. I'd get the left leg up on something, let's say it's your bed, a bench, maybe a small chair at home on the left side of me there. Get into that tucked pelvic position, and then same thing, just translate my weight forward. The difference you'll feel here is that stretch is going to be more localized to the front of the hip. You won't see as much radiation down through the thigh if you know you're someone who has some psoas tension there. So hopefully that instructional video was helpful in getting more out of your hip flexor stretching, especially if you're going to be doing a little bit more sitting over the next coming month or so. Now, a couple things I like to mention just in terms of a general prescription I'll give to people and just stretching in general. Stretching is a lot more about finesse than it is the true range of motion that you're getting out of the movement. I'd rather you move an inch properly than 6 inches where you're flaring through the back in case of the hip flexor stretch. You might think that you're mobile through the hips, but when you actually tuck that pelvis down, you'll realize that there might be some underlying tension there that you weren't previously addressing with the stretching you were doing prior to this video, okay? As a general prescription in terms of releasing some of that tension, I usually tell people, I want you to aim for a 30-second hold. There's not a ton of benefit to going longer than that. You should ensure you're going to an intensity of the stretch where you can still breathe comfortably and you don't feel like you're tensing up against the pulling sensation of that stretch. Aim for 2 sets of 30 seconds, both morning, afternoon, and night, and that's a really great place to begin. As we mentioned previously, if this works for you, awesome, glad it helped. If you're still struggling with some of that hip flexor feeling of tightness or tension, even after implementing the stretching, then you might be one of the people who will benefit a little bit more from strengthening, and that's totally something that we can cover in a following newsletter or an additional video. So, if this helped, let me know. If there's any other exercises that you'd like me to go over in terms of form or things that I commonly see people do incorrectly with any sort of stretch or exercise, let me know. I'd be happy to address it in a following video. But once again, thanks for tuning in to the September edition of the newsletter. Enjoy your time back to school, back to the office, hopefully not, or back to university, and we'll catch you in the next one. Take care.